Nako, sorry. May napindot ako.
Enough mo nga.
Oo. Oh, sorry.
Good afternoon, everyone. Before we start, let us pray to bless this event in each of us. Dear Heavenly Father, we thank you for allowing us to be together today in this webinar about surgery. May you bless us with focus and understanding so we can apply the significance of this webinar in our profession and everyday lives. May you guide our speaker as she shares her knowledge and experiences. And may you always bestow us safety, strength, and healing through these trying times. All of this we offer to you. Amen.
Good afternoon,
Good afternoon.
everyone.
Sorry po, Doc.
I'd like to welcome everyone. I'm Ian Hagnis of Dalubhayop and Pets United here in Puerto Princesa. I'd like to welcome all of you to this episode of Dalubhayop Tech Talk. This afternoon, we'll have a very interesting topic, and I hope you'll stay throughout the webinar, as we'll have the games later at the end of the webinar. We have Doc Ivy here with us, and then we have some Palawan-based veterinarians and some students and practicing veterinarians here in the Philippines. And we have a registered participant from California, Dr. De Villa, and someone from Singapore. So Tristan, let's continue.
Thank you po, Doc. Good afternoon, doctors and students. My name is Tan.
And I am Trish. May we welcome you to the Dalubhayop Tech Talk presenting
Surgery Essentials, Common Pitfalls and How to Prevent Them.
In partnership with UP Rodeo Club and UP Taluridan, ang mga Palawenyo.
Again, we would like to thank everyone today who gave their time to join us in this learning journey.
That is right. And to ensure the smooth flow of our event, may we remind you with the following rules.
First, please edit your profile name so we can address and recognize you properly. For the veterinarians, please put doctor, your name, dash, your company, and for the students, please put your name, dash, the initial of the school you are in.
And may we request everyone to turn off their mics so we can avoid unnecessary noises. You can find the mute or unmute button in the bottom left corner of the screen. If the microphone symbol has a red line across it, it means that you are on mute. Beside it is the video button. Again, we request everyone to turn off their microphone and video during the event, but we highly encourage you to use this during the Q&A session later.
And as mentioned, we welcome your questions. May you use the raise hand button so that we and the speaker can recognize you easily.
If you are using a laptop or desktop computer, the raise hand button can be found on the lower right side of the screen. You can click it when you have any questions or concerns, and you can also see different emojis which you can use to react to our event.
And if you are on mobile device, you can see a three-dot symbol on your lower right. When you click it, the raise hand and reaction buttons will appear. You can use the raise hand for your questions, and please also lower your hand if your concerns have been answered.
For the reaction buttons, you can use the clap button to give us and the speaker a virtual applause. You can also use the thumbs up or yes button when you agree to what was mentioned.
You can use the heart button if you love what we presented to you, and the laughing button to give us support during funny conversations.
Now, during the Q&A, we are allowing you guys to turn on your mics and camera. We greatly appreciate your participation, thus we request you to use the microphone to ask your questions. But if technical difficulties arise, you can use the Zoom chat box. Again, please first use the raise hand button to be recognized.
Lastly, our digital certificates will be provided after the completion of a post-meeting survey. Please watch out for the link of the survey to be given later in the Zoom chat box.
Moving on, this webinar is brought to us by Samahan ng mga Dalubhasa sa Palagamutang Hayop sa Palawan. And to introduce us further to Dalubhayop, we have Dr. Orestes Borja.
Good afternoon to everyone. I am Dr. Orestes Borja, veterinary medicine from La Salle, Araneta. This afternoon, allow me to give you a short introduction of our organization, Dalubhayop. Dalubhayop stands for Samahan ng mga Dalubhasa sa Palagamutang Hayop sa Palawan. Dalubhayop is an association of licensed veterinarians in the province of Palawan and presently based at Puerto Princesa City. It was organized and founded last 1994 with 9 pioneering members headed by late Dr. Jerry Ortega. Its primary aim is to work for the welfare of the members and veterinary profession in Palawan. Also, the association exists to protect the rights and interests of all the members, promote the professional development, and enhance the recognition of veterinary profession, particularly in Palawan. Also, the association aims to unite all the members of the veterinary profession in the province of Palawan into a single body capable of playing an important role in the promulgation of professional and ethical standards in the practice of veterinary medicine, science, and medicine. At present, the association is represented by more or less 25 veterinarians. Dalubhayop is an affiliate member of Philippine Veterinary Medical Association. Thank you very much. Good afternoon.
Thank you, Dr. Borja. And supporting the Dalubhayop in this event, our partners, UP Rodeo Club and UP Tarabidan E ang mga Palawenyo.
UP Rodeo Club is an exclusive academic organization for the veterinary students of UPLB. They specialize in teaching students the importance of rodeo sports.
And UP Tarabidan E ang mga Palawenyo is a varsitarian organization also in UPLB that creates an environment for students from Palawan.
On behalf of everyone, we thank Dalubhayop and its partners, UP Rodeo Club and UP Tarabidan E ang mga Palawenyo for bringing us this educational event.
Before we proceed on the talk, we would like to know what you guys have in mind. We will be releasing a short poll for all of you guys to answer. So first up is William Stewart Halstead is British, American, a veterinary surgeon, a human surgeon.
The second question is Halstead principles. Is it hemostasis, aseptic technique, light touch, or a traumatic surgery, supply of blood to serve, tension-free suture, even tissue apposition, dead space obliterated?
The third question is, among the suture materials below, which takes longest to absorb? Polyglactin, polydioxanone, silk, or nylon?
The next question is, the smaller the spay wound, the faster the healing. Is this true, false, or it depends? Okay, I think our poll has ended. Partner,
So,
can you read the first one?
so for the results, William Stewart Halstead is, the most vote is a veterinary surgeon.
Regarding the Halstead principles, uh, hemostasis and aseptic technique got the most votes.
Now for the third question, among the suture materials below, which takes longest to absorb? The one that got the highest vote is nylon.
And the last question, the smaller the spay wound, the faster the healing. Most people answered true and it depends. Thank you everyone for answering our poll. Now, I think this is what we all have been waiting for. The talk proper. Partner, may you introduce our speaker for today?
Of course, partner. So our guest speaker for today is a graduate of Doctor of Veterinary Medicine from University of the Philippines, Los Baños, class of 2003, and also the CEO of the Animal Wellness Veterinary Hospital and Clinics.
She also has several surgery training in different areas, such as soft tissue surgery class in WBC Hands-on Training 2020, orthopedic surgery class in VPAP 2018 pre-Congress under Dr. Laraya back in June 2018, and under Dr. Alain Kahalane back in October 2017.
Head and neck surgery class under Doc Alain Kahalane back in 2015, gastrointestinal surgery class under Dr. Alain Kahalane back in 2014, neck and spine surgery class in VRVC, Veterinary Practitioners Association of Thailand pre-Congress, and orthopedic surgery training in PAHA 2010 to 2011 under Perth University orthopedic professors.
She also has international peer-reviewed presentations, one of which is the diaphragmatic hernia repair with the assistance of anesthesia rebreathing bag in the 43rd WSAVA Congress in Singapore back in September 2018.
and reattachment of a completely severed maxilla in a 6-month-old dog in Cebu, Philippines, in the 41st WSAVA Congress in Cartagena, Colombia, back in September 2016. Ladies and gentlemen, let us all welcome Dr. Ivy V. Alvarez Zialcita.
Good afternoon po,
Ah.
Doc Ivy.
Cue ko na pala yun.
Good afternoon
Good
po, Doc.
afternoon. Maraming salamat sa pag-invite sa akin para sa mga taga-Palawan. Thank you so much. Para sa mga taga-RC, mga brothers and sisters. Hello. Okay, so this afternoon, meron tayong special guest din from the US, Doc Raymond. Siguro pwede rin siya mag-share later. Okay? And then I'd appreciate if you can turn on your video para tayo nasa classroom. Hindi ako lang yung tao. Okay? So, this afternoon, it's going to be easy. Ano lang, chill lang and review para sa ating lahat. Okay. There. Nakita niya na yung slide ko, right? Yes? Okay.
Yes
So
po,
this
Doc.
afternoon,
Yes
we'll
po,
discuss
Doc.
about surgery essentials. Ano ba yung mga kailangan natin during the procedure? We need our important instruments. Okay. So for me, ang pinaka-important for me are my meds, my forceps, and my needle holder. And yeah, pati ang scalpel blade kasi paano mo bubuksan without it. Okay. So, ito yung mga pinesent namin during the WASAVA Congress. WASAVA is World Small Animal Veterinary Association, the biggest association for small animals in the world. Okay? So, pride and joy namin. Okay, the first one is buhay pa rin siya up to now and nasa Canada na si Kenneth with his new life. And the other one naman, diaphragmatic hernia. Most of the time, sa ibang bansa, kailangan nila na ventilator to perform this one. But since we don't have it in our practice, manual, may taong nagmo-monitor talaga sa patient during the procedure. Okay. So, na-share sa akin to ni Dr. Ian. And then, what are you excited about this afternoon? May sumagot na anesthesia. Well, para doon sa mga excited about anesthesia, surgery lang po ang i-discuss ko this afternoon. So, June 15 ang next na anesthesia class under the same event din no, ng Dalubhayop. Okay? And then yung iba, I touch up lang natin yung easy procedures na frequent natin nakikita. And for this afternoon, we'll only discuss about soft tissue surgeries pertaining to the abdominal cavity. Okay, so our discussion will be, let's go back to basics, exploratory laparotomy, and some soft tissue surgeries. Okay, gusto ko magtanong kasi syempre gusto ko malaman kung anong thoughts ninyo. Exploratory laparotomy ba for you is a diagnostic procedure or a surgical procedure? You can actually type that in the chat box para malaman natin. Okay? Ooh. Paano ko pala makita ang chat box? Siguro review natin later or siguro i-discuss ni Dr. Ian or ng two co-hosts natin. Okay? Okay. And then, hold on. Balik tayo. How do you, nakikita niyo ba itong nakalagay na search? Hindi naman siguro na. Okay.
Hindi ka nakikita.
Hindi. Okay. Yung picture
Nakikita
lang,
daw.
correct? Nakikita. Paano ba natin tanggalin yun? Sandali. Ayan. Okay. Balik tayo ulit. Sorry. Ayaw na bumalik. Okay, so how do you hold your surgical instruments? So I hope you remember this in class. We call this the pencil grip, or if you want, the pen grip. Do not forget, hindi kutsara ang instruments natin for surgery. So when you hold them, do not forget to use it properly. Kasi nandito yung stress level na kaya natin gawin para sa soft tissue or sa even sa sa mga bones. And at the same time, mas less yung kaya nating sirain pag ito yung tama natin na grip na gamitin. Okay? That's the pencil grip. And then, ba't ayaw na naman? Ito na. Okay? Sorry, ayaw na mag-move. Yan, naririnig mo yan? Thank you. Ayaw niya mag-move. Ayan.
Yeah.
Ayan. Balik na. Thank God. Kinabahan ako dun. Okay. And then do not forget your aseptic technique. So, importante sa atin yung sterilization. So, not only that we make sure that our hands are clean, you make sure that your instruments are also clean. Okay? Do not forget to autoclave. Yung iba, walang autoclave, so they use the liquid sterilization. Pero if you're doing procedures, especially if you are a private practice, please do invest in an autoclave machine. If you cannot afford the most expensive one, get something that you can pay for. Kasi if we are offering surgery na service, it means na meron tayong mga gamit. But again, I would like to remind everybody, kung veterinarian ka, it does not necessarily mean na kailangan mong mag-surgery sa practice mo. Okay? Because surgery, it's a skill and it's also an art, and not everybody has that skill. Okay? Look for that perfect skill for you. Okay? So surgical preparation, yung gamit, and yung gowning. If you're going to do major surgeries, please prepare for it and gown. Okay? Ang washing, make sure that you have water, you have yung brush at saka yung what you call this, triclosan or betadine. Okay? Here we go again. And there you go. So basic tools. For me, you can get your basic tools in colored na instruments. So it's easy for you to look for them in case you do your major or minor surgeries. I separated what I love using the most. Okay, my meds and balm scissors. It's very, very important. You can also sharpen this one after you clean it. Para sa next procedure, it's easy to use. And then your needle holder, you can get one with scissors para mas mabilis. Ikaw na ang magtahe. Ikaw na rin mag-cut. And then your rat tooth forceps. Okay? Okay, Halsted Principles, natanong to earlier. Ano ba siya? Ang galing ng Halsted. Isa pala siyang veterinarian from the US na pumunta sa Europe. Medyo na-disappoint yung mga European to find out na he's American. In the, yung ngayon. So, he's also the one who started the gentle tissue handling, control of hemorrhage, preservation of blood supply, ang strict na aseptic technique, and then ang pag-minimize also ng tissue tension. Kasi sometimes nanggigigil ang iba magtahi. Sobrang higpit to the point na hindi ka magkakaroon ng accurate tissue apposition. And as well as elimination of dead space para mabilis mag-heal ang lahat ng portions na binuksan mo. And the importance of rest para mabilis makarecover ang pasyente. Okay? Okay. For me, aside from sponges, I also would like to recommend that you have your own suction machine. It's not too expensive and it lessens the cost of throwing away your gauze sponges. So, mabilis siyang gamitin. Plus, you can also look for tips that you can use. And then, mabilis din siyang i-sterilize using your autoclave. Okay? And then, if you are a private practitioner, please do invest in suture materials. It's very important kasi gone are the days na gumagamit tayo ng spool of silk. Okay? I would understand kung ginagamit yan sa ng mga estudyante or also ng mga free spay and neuter kasi walang bayad yun. Pero kung binabayaran na tayo, it's about time to level up and make sure that our patients won't have a lot of reaction after we do our procedure. Okay, so my pride and joy, this is the best part of the hospital that I love the most, ang surgery room namin. Kasi lahat ng kailangan ko na dyan. Pag wala dyan, naiinis ako. Kasi syempre, in the middle of the surgery, you can't buy anything that you need. You need to be prepared for it, okay? And then, naka-ready kami for any 2 procedures at the same time. But then again, depende. I mentioned earlier, hindi naman kasi lahat ng clinics are required to have their surgery rooms. Yung iba, what I would recommend is that you start using referrals. Kasi marami naman tayong mga neighborhood na meron din silang mga ganyan. Correct? Okay. Okay. Now, question. Eto. Kailangan ko ng tulong, Dr. Ian, Tristan, and Trish sa pagbasa ng sagot. Okay? Okay, so meron akong 2 arrows dito, yung orange at saka yung purple. Sino, can you chat sa chat area kung ano-ano yung mga nakikita, ang frequently seen na soft tissue na nandito sa may orange na arrow. Okay, and then, ayun, meron pala. Ayun. Maganda pala na sabi ni Doc Raymond. He was a human surgeon, not a veterinarian. Thank you, Doc Raymond. maganda yan. Pero, okay, ano siya, bidang-bida siya sa veterinary world. Okay, share ko rin sa inyo later. Okay. I don't think you should have your autoclave in the OR. Try to take it out. Maganda ring ano yan, message, okay? Or do never use it during your procedure at all. Okay. So ano na sagot natin? Wala pa ba? Ano nakikita natin pag binuksan natin ang isang hayop pag nasa taas ng umbilicus? Ano yung frequent? Or ano yung mga gusto natin makita doon in case we do a procedure? Meron ba tayong sagot? Wala pa. Okay, bigyan ko kayo ng ng secret. Okay. That's from the umbilicus going to the sternum. So ano yung nakikita natin doon sa sternum? Okay? Okay, wala pa rin. Mahihain pala yung mga taga Palawan. Pwede ba tayo mag-open na video? Baka natutulog. Ayan, thank you, Dr. Pat. Okay. Liver and stomach. Very good. That's a very good answer. Aside from that, meron pa ba? Ano yung nakadikit sa stomach? Or sa malapit na niya sa stomach? Spleen. Yes, very good. Stomach, liver, spleen. Very good. Spleen. Oh, Dr. Francis Reclenco. Hi, Doc France. Okay, yes, andyan. And if you have your diaphragmatic hernia, okay, that's also where you would like to open. Okay, so diaphragm, your liver, your gallbladder. Okay, maganda yan. Tapos yung stomach and yung attachment ng spleen. Okay, now let's go down to, oops, cheating na to. Okay, let's go down to the purple arrow. Chat naman tayo. Okay, ano ba yun nasa purple arrow? Okay, after natin makita, ano ba binubuksan natin dito? Every time we want to do a surgery, ano nakikita natin? Frequent to sa mga spay and neuter. Okay, intestines. Okay, bladder, urinary bladder. Okay? Tapos, pag babae, ano meron dyan? At in case kung lalaki, okay, uterus, your ovary. Okay. Okay, ovary, uterus. Pag lalaki naman, pag may retained testicles, dyan din natin nakikita. Okay, so now, okay, very nice, very interactive. So I summarized, okay, pag enlarged yung spleen, especially if you use medetomidine during your procedure, ito yan, below this may purple, pero pag hindi, tas kailangan mo, kunwari may splenic torsion, you go upper. Kidneys, since hindi klaro dito yung umbilicus, I put it in between. Kasi merong right side na medyo higher than the left side. Okay? Okay, proceed tayo. Ayan. Ayan, balik tayo ulit. Hold on. Okay. So this dog was presented to us with chronic vomiting. Bloods and imaging were already taken and there was something there during the radiograph. I can't remember though kung ilang oras to afterwards bago namin binuksan for expiratory laparotomy. So ang tanong namin was, what's causing the chronic vomiting? So paghanap, okay. And when you look at the bowel, always check if there's peristalsis, especially sa areas that are discolored or no vascularization, so that you know which ones to remove and which ones to retain. Okay? So, okay. One more tip for expiratory laparotomy. Ano siya talaga, malaking opening. Walang expiratory laparotomy na maliit. Kaya ang tawag sa kanya expiratory. You will explore. You don't know what's there. Okay? It's considered as a diagnostic procedure because once you go in, dun mo na malalaman kung ano surgical procedure yung kailangan mong gawin. Okay? So sometimes you might need to remove some mass on the liver, some mga nag-torsion na spleen. na alam mo na it will not recover again. Sometimes maraming mga nakikita sa intestine. Okay sana kung yung pag-take mo na x-ray, makita mo agad may bato doon, may lata, may needle, may whatever that you can see in the imaging. But sometimes may rugs na nasa loob. Minsan meron naman yung corn cob, which we hate the most. Kasi yung corn cob, dapat magaling yung ninyo, yung nasa imaging na mag-identify na nandun siya. Okay, at saka yung mga mango seed. We hate mango seed. They can get stuck there and can kill your pet because of septicemia. Okay. Tapos, general approach, ito naman, cat patient for ovarian hysterectomy. So, let's start from the start, no? After mo mag-scrub, mag-gown, and then ito naman yung susunod. Okay, ups, balik. Okay. So, drape. Okay, drape your patient. Well, if you have longer drape, mas maganda. It's better like this one, ang ganda na drape na to because it doesn't absorb water. So, mas safe yung patient. Pag na-absorb yung water ng drape, mabilis na bumaba yung temperature ng pasyente. Pagbaba nun, ang bilis niya magkaroon ng bacterial infection. And then, okay, locate your umbilicus before you cut anything. And make sure na yung likod ng patient niyo is balanced siya, no? And then naka-side view kasi baka mamaya yung cut niya is not precise, then naka-side view rin yung cut, okay? So after niyo i-cut, open. Okay. So use your meds. Okay. Expose and look for your linea alba. Once you have it, and puncture that. Elevate it para hindi niya matamaan yung ibang organs na nasa baba. Cut. Okay, according to what you need. Okay, and then what we normally do, our anesthesia team, they would put local anesthetic inside. And then yung local anesthetic, it lessens the pain of the patient. So, mas konting gas anesthesia yung kailangan naming i-maintain. And at the same time, depending kung gaano katagal yung effect niya, makakatulong din sa healing. Tapos, they ask us to stop for a while. And then, after a few seconds, we can proceed with the surgery. Okay? Okay. So, eto, maganda to for ovarian hysterectomy, for spaying. Please do not forget to remove the entire ovary when you do your spaying. Kasi ang dami na parang kapiraso lang yung tinatanggal. So, in the end, nagkakaroon pa rin ng pyometra, stump pyometra yung patient. And then once na ginawa ulit yung procedure, mas malaki na syempre yung butas na kailangan natin na i-open, correct? And then, tatlong putol-putol na areas na kailangan nating balikan. So, it's better if you do it once and you do it properly by actually releasing the suspensory ligament para mailabas niyo ng buo ang ovary before you start your sutures. Okay? So, better if marunong kayong mag-constrictor, pero sa video na to, na-conscious ako, so ilang beses na tanggal, we decided na bumalik sa basics, okay? And then, okay, for the sutures naman, I would recommend for you to use what you are comfortable with, especially kung ang procedure naman is soft tissue, okay? Except kung liver or yung mga very special na soft tissue na kailangan na meron tayong i-follow na suture pattern. Okay? Okay, so for the urinary bladder, what I would recommend is that if it's not too distended and enough para ilabas, pwede lang natin siya i-pop by assistance ng hand ng surgeon. So, one finger will be holding one side of the muscle. And then other hand will be pushing it outward. Okay? And then paglabas, there, you have your bladder. Oops. So in some cases, yung bladder, medyo malaki masyado. So it's better if mabawasan mo na yung load. Okay? So, saan naka-point ang pointer natin? Okay? Ano ba siya? Lalaki, babae? Girl, boy? Bakla? Tomboy? Okay. So, okay. Ano siya? Lalaki. So, castrated. That's why not so obvious ang penis niya. Plus, very discolored yung skin. This is an 11-year-old, no? Neutered dog that was presented to us because of urethral obstruction. So yung pointer, normally that's where I cut. And then I would either go down or go up depending on the size of the urinary bladder. So this patient, meron din siyang maliit na umbilical hernia. Hindi naman nakaka-bother sa patient, but since I'm already there and I needed to open higher dahil kailangan ko ilabas din yung bladder niya, then we decided to repair it as well. Okay, so paglabas ng bladder, make sure to put your stay sutures. I normally just put 1, but it's better to put 2 depending on your comfort level. And then after that, aspirate and then use your spoon to remove the stones. Okay. Okay. And then ito, pinaka-common for all intact female na older or the pyometra. Sometimes diagnosed talaga yung patient. That's why they undergo surgery. In some cases naman, nagpa-spay lang si owner and then nag-start na palang magkaroon ng pyometra yung patient. So for pyometra, I would recommend, and ngayon, even lahat ng mga surgeons would already recommend spaying. And that's the best treatment for pyometra. Gone are the days na may option pa, di ba? Na antibiotic lang. But then remember, they go into heat every 6 months. So because of that, ang chance din nila na mag-pyometra every 6 months is medyo mataas. What we found out, kasi there was a class before that I attended that they mentioned na they were checking kung ilang female ang polycystic or may problema sa ovary. Kaya sila nagpa-pyometra. But the thing is, I can't remember though if taga Netherlands yung speaker. Na na-mention niya is that there's very minimal number na pwede nila kuhanan kasi halos lahat required sila ipaspay yung dogs. So ginawa namin sa clinic, although hindi pa kami nakakahit ng 100, and we found out na dami nga talaga sa kanila na either unilateral or both sides ng ovary nila are polycystic. So for pyometra, okay sana kung naka-open siya the entire time because fluids will come out, right? But we have seen several cases na sobrang enlarged ng horn of the uterus and then ang body of the uterus, ano na siya, maliit na, constricted. Or pwede rin yung history niya was that may tumutulo, may nakita ang owner, na akala nila abs. And then yung pala, secretion from the vagina 2 days ago, but they haven't seen it like today or yesterday. And then pag open namin truly, ang laki ng horn and then maliit na yung body. So in cases like that, tas sabihin lang natin sa kanila na antibiotic lang para lumabas. And pag hindi lumabas, malaki chance na mag-rupture nito sa loob. So our problem will be peritonitis and septicemia. And the most common cause of death of pyometra, even with surgical procedure, is septicemia, especially kung medyo late na nadala or meron na signs sa bloods nila. Okay? So, eto. I think start pa lang to. Pero, ang laking chance nito na may parts na medyo malaki, may parts na walang constricted siya. So, most probably, hindi lalabas ang pus. Okay? Okay? So I think that's the end of, hindi, summary. Ang ganda kasi ng discussion namin ni Dr. Ian last night. And then please remember, ito yung summary ng wound healing na hemostasis first, then inflammation. You just want enough inflammation para mag-heal. If it's too much, then nahihirapan din na mag-heal yung part na na-incise natin or ginawa na surgery. And then proliferation and remodeling. So there are some wounds, if it's clean and then hindi ganun kalayo yung gap and then it's not that extensive, then pwede siya mag-heal on its own. Meron din namang ibang wounds sa sobrang lalim na pag hinintay mo mag-heal, ang tagal-tagal. So it's better na pwede na natin i-consider ang surgical procedure para mapabilis yung healing. And then you may also use laser therapy after the procedure, or you may also use hyaluronic acid. Maganda siyang aftercare dun sa insertion site. Okay. And then, that's it. Gustong-gusto ko tong photo na to kasi parang nainis yung pusa namin. Lumapit siya dun sa isang pusa, hindi gumagalaw. So pagtalikod niya, nainis siya. So, thank you again for watching this afternoon. And should you want to work in Cebu or Dumaguete, please join our medical team and you may actually send your CV and application to animalwellness.hr@gmail.com. Okay. Okay. So I think that's it.
Wow! Thank you so much, Doc Ivy. That was such
Yeah.
an informative presentation. Actually po,
Oo.
ako as a second year veterinary student, this made me
Mm.
really excited to take surgery classes na po sa mga higher year. I think
Oo.
si Tan din po.
Ah, wow.
Yes naman
Oo,
po,
exciting
Doc.
talaga yon.
As a freshman pa lang po, Doc, like, I'm looking forward na to my surgery classes.
Ay, maganda yan. Kasi marami rin kami mga classmates, sobrang talino. And then they look forward to IM, internal medicine class, IM surgery, or imaging class. So, depende, no? So, yeah, I'm glad na gusto niyo rin mag-surgery. Okay, may mga
Ayun.
questions kaya tayo?
Ayun po. And since Doc Ivy is already here, I think meron lang po kaming few reminders before we proceed to our question and answer portion.
Okay, for us to recognize you guys easily, may we remind you again to please change your profile names accordingly. For veterinarians, please put doctor, your name, dash your company. And for students, please put your name, dash the initial of the school you are in.
And for us to hear each other clearly, please keep your mics on mute until you are called. Also, we now recommend everyone to turn on their cameras for us to see each other's beautiful faces. Again, you can see the mic and video button on the lower left of your screen. When there is a red line across the icons, it means that you are on mute or your video is off.
That's right. And to facilitate our Q&A properly, please use the raise hand button for us to notice you. You can find the button on the lower right of your screen, or if you are using a mobile phone, you can click the three dot icon, then the raise hand function will appear.
Again, we request everyone to turn on their cameras and use their microphones to ask your questions. The floor is now open for you to ask your questions to Doc Ivy. You can also chat your questions if you are unable to unmute your mics or open your cameras.
Wala.
Hi,
Wala
Doc
eh.
Ivy.
Yes, Doc. Akala ko
Oo,
wala, okay na sana eh.
ako muna. If
Okay.
if I'm a beginner, or for example, nagsisimula lang ako sa practice, which among the suture pattern should I master? Alin ba dun yung kailangang makabisa ko at ma-perfect before I proceed?
Magandang tanong yan, Dr. Ian. Okay, si Doc Ian, docmate ko yan. Okay, so start with the very basic. Continuous suture pattern, I would suggest. Ginagamit siya ng sobrang daming surgeons. As long as you know how to do it properly. You know how to do it properly. Bakit ganun naman yung sinabi ko? It's because meron siyang at least 1 centimeter before and after the incision ka dapat na-start ng first na throw. Okay? At least that one, siya yung may pinaka-best na tension na kayang ilagay ilagay doon sa insertion site. Before, gusto-gusto natin gamitin, di ba, nung estudyante tayo, ang interrupted na suture pattern. But then, ang interrupted suture pattern, for every knot that you make, ano siya, ang taas na tension niya, sobrang bilis. Ang laki ng chance na magdihis siya. So, if you're not really comfortable doing just your continuous suture pattern, kasi iisipin natin, parang easy naman nun, baka mamaya, ito pa yung bumitaw while healing. I would suggest na you can also put in between, no, especially kung sobrang taas ng incision site, you can also put your continuous, not continuous. So, continuous suture pattern, and then you can also put your interrupted in between, parang support, if you feel more comfortable with that. So, yun.
Yung continuous suture pattern actually is very fast, di ba? Pero how do you make a perfect continuous suture? And one more thing, sa knots, how do you make sure that your knots are very good?
Okay, wait lang ha, may binasa ako doon sa chat. Sorry, Dr. Ian. First, how will you know? Ano yung first one, Dr. Ian? About the suture?
Yung how to make a strong continuous suture kasi
Okay.
it facilitates yung closing yung bigger wounds such as X-lap. You'll save a lot of time at less ang sakit sa likod.
Yeah.
And then
Sobra.
and the second question is about the knots. How should you make your knots secure?
Sobrang ganda. What I do, especially kung exploratory laparotomy, because sometimes you'd open from sternum all the way to pubis for that one, especially if you're not exactly sure what you're looking for. Diba? Kung nasaan na ba, ano ba hinahanap mo, ano nangyari. Okay? So pag ganun, kataas, what I would do is, ganun pa rin, at least 1 or a little more centimeter away from my incision, ang start ko. And then ang knots for my suture material, normally I use PDS or PDX na suture material. So that's a mono filament. So I would do at least 5 throws for my knot para sigurado na it won't slip, or if it would, then at least ano pa rin siya, sigurado pa rin na sarado siya. All the way down, and since ang haba na nun, nilalagyan ko siya ng either yung cross or simple na interrupted in between. And then yung ending niya is the same. At least 1 or at least 1.5 centimeter away from my incision pa rin yung ending ko. Para hindi siya nakapatong sa sugat. Once kasi na nakapatong sa sugat yung yung knot, ang taas-taas ng tension. Parang ito yung kamay ko. Tapos diyan ko pinatong, no, dito sa dalawa, yung first ko na knot. Pag nilagay ko dyan, and mabigat yung aso, kahit hindi siya mabigat, bukas kasi yan, di ba? So, ang bilis na chance na magdidihis yung yung suture, or mapapahiya ka sa sa tahe. So, you go higher dun sa walang sugat. At saka you go lower dun pa rin sa walang sugat after you end. Did I answer your question, Dr. Ian? Kulang ba?
Okay.
At kung kulang, ano yun? Kasi ang haba, complex yung question. Okay na ba? Okay. Ayan, si Dr. Patty may tanong.
Hi, Doc.
Hi, Doc Pat.
Yeah. Ano ma-recommend mo na makabawas or kung pwedeng ma-avoid yung adhesion, especially yung mga surgery na katulad ng cesarean, ganyan, di ba? Paulit-ulit yan eh.
Yeah.
So, what's the best thing to do para yung adhesions para sa mga susunod na doktor, hindi siya mahirapan magbukas ulit at maghimay?
Sobrang gandang tanong ni Doc Patty. Okay? Wait lang ha. Si Dr. Carmela, may tanong din siguro. Wait lang po, sagutin ko muna si Doc Patty. Okay, so Doc Patty, sobrang gandang tanong niyan. Kasi yung iba is paulit-ulit nga, especially kung breeder, yung female. So I would suggest you use monofilament PDX na suture material para ang adhesions mo is much less. At saka ang cut, if you can, one cut. Kasi pag medyo mas maraming area kung saan pwedeng yung, let's say, may mga abrasions yung tissue, dun dumidikit yung iba pang tissue. So sometimes you can see na yung uterus nakadikit na sa bladder, di ba? What's worse is that sometimes yung uterus is nakadikit sa small intestine and bladder and di mo na alam. And then ang suggestion mo is pay and yet paano mo tatanggalin, di ba? So yeah, I would suggest monofilament is the best way. Okay.
Ayun po, Doc Ivy, meron po tayong question sa chat box from Pearl. Hello po, Dr. Ivy. Would you recommend doing a subcutaneous suture pattern for closing po ng explolap? Thank you po.
Continuous suture pattern? Ano? Pakiulit daw, sorry.
Po.
Subcutaneous. Okay. For the subcutaneous naman, yes, please go ahead and close that with your subcuticular na suture pattern. Importante yan because it will remove all the dead space. Never forget na yung mga dead space kasi if you leave that, ang tagal ng healing. So para maghihintay ka, tapos nandun pa lahat ng mga dugo, nagkaka-edema pa yung area. So better to remove all that dead space and use please subcutaneous na suture pattern. Okay. Ang ganda rin ng advice dito, no? May isang advice din si Dr. De Villa. You can also do an interrupted continuous if the incision is very long. I agree with that. Especially kung may area kasi, let's say you start from the sternum all the way to the pubis. Ang haba niyan. So if you leave that open, every time na humihinga yung pasyente mo, bumubulwak yung mga organs na ayaw mo makita. So yeah, I agree with Dr. De Villa kasi ganyan din yung ginagawa namin. We do it per part, bukas, sara, bukas, sara. And then just make sure na parang babalik ka ulit kung continuous suture pattern. Ano ka pa rin, gawin pa rin yung 1 cm away from your incision na concept. Okay. Another question pa dito. I mentioned earlier na hindi lahat ng vet need mag-surgery as a profession, as it is a skill and an art. What made you want to pursue surgery po? I find it really exciting. That's why I went into surgery. And I love doing puzzles. Kasi minsan, pagbukas mo ng patient, it's not all normal. It's good if you're just doing the regular spay and neuter. Pero minsan kasi, you can see very enlarged kidney that you cannot recognize anymore. Or sometimes, dikit-dikit na yan, like na-mention ko kanina kay Doc Pat, no? CCS ka and yet hindi mo na ma-identify kung which is which kasi dikit-dikit na lahat. So you need to figure out kung paano mo sila ihiwalay, aayusin ulit without bleeders, without also causing yung tawag dito. Minsan kasi pag na-excite tayo, 'di ba? Sige, pasok. Tapos bigla ang lalaki ng mga blood vessels doon. So pag kinilig tayo sa cut ng cut para sikat, edi patay yung pasyente. So dapat pati lahat noon very careful tayo. Yeah, I think I enjoyed it kasi para siya puzzle for me. But then again, they mentioned mga magagaling na surgeons are not really smart daw. Kasi yung mga IM daw, utak yung inaalagaan. Pag surgeon daw, kamay lang. So, parang hindi naman sa lahat. Nakakasakit naman ng puso din yun. Okay.
Doc Ivy, I think may tanong po si Doc De Villa.
Yeah. Nako, Doc Raymond. Ano yung tanong ni Doc Raymond? Nakaka-stress sa Doc Raymond. Yes, Doc Raymond.
You're muted po, Doc.
Okay.
Doc, yung easy
Good.
lang ha. Estudyante mo ko dati.
We're doing this para at least hopefully to inspire the students who are watching to do surgery. No, I just wanted to add something dun kay Dr. Patty. one thing that you can do if you really are afraid of adhesions, especially for breeders na repeated, you can tack the omentum over your incision site. This way, it will adhere to the omentum and not
Mm.
necessarily to the other organs. And that still makes it easy to move. You can always cut off the omentum. It's very easy to take it out when you want to do your surgery again, rather than, as you mentioned, let's say the uterus is attached to the bladder and so on. So that's one method that you can use. Just an addendum.
Yep. Sobrang gandang technique. Maganda yan, Doc Raymond. Pero sana may momentum pa na natira, Doc Raymond.
Well,
Kasi may mga
hopefully,
cases na iba na parang, wow, saan yung momentum nito?
or
Yeah.
to avoid that, tell them that sorry,
Mm.
it really needed to be spayed at the same time. Then no more problems.
Yeah. Basta, Doc, matanggal lang yung buo. Pero yeah. Uy, ano pala, for our participants, this is the best time. Kasi si Dr. Raymond is in the house. Pwede rin kayo magtanong kasi iba rin yung experience niya sa US. Kasi sobrang
Ayun po.
strict siya, di ba, Dr. Raymond?
A little bit lang. And then,
Yeah, may nakasabay ako, Doc, sa WVC last 2020. Mga 20 years na siya nagpa-practice. Tapos sabi niya na, okay, alam mo na ba to? So, ginagawa na namin. So, niyan, buti pa sa inyo, no? Kasi dito, dapat, mga specialist na yung gumagawa. May mga restrictions dahil nasa Amerika. So,
well, ang advantage ng Filipinas is at least you don't have anybody to refer to. So you really have to learn to do it yourself. Here,
yeah.
if you attempt something that you're not familiar with and something goes wrong, might end up with a lawsuit.
True. Pero Doc,
So,
ngayon matatapang na rin mga tao dito.
they'll take it to court. Yeah. So you need to, but when you do it, you have to be sure that you prepare yourself. And at least for the students watching, do not forget your anatomy classes.
Yep.
And if you're about to enter into something that
mas
you don't
magagaling ang mga Pilipino, Doc. Di ba, Doc Raymond? Mas magagaling ang mga Pilipinong
make
dents. Kasi alam mo lang.
we know how to improvise. Okay. And along with that, you just prepare yourself. If you're going to enter into something that you have no idea, it is the first time, read, review, and more likely there's going to be a YouTube video on it. So look for it, watch it, learn about it.
Doc Raymond,
then-
about
Yeah.
about the YouTube videos, just make sure na yung pinapanood
It's
niyo
correct.
legit. Yeah, kasi
Mhm.
minsan talagang pinuputo lang na parang chinap-chop. Okay?
I mean, always look at it with a critical eye and always ask
with a grain
yourself,
of salt.
why is he doing it this way? Why not this way? And if you can convince yourself that it's the right method, you can follow that. If not, look for something else or try to invent your own.
Yep.
And prepare yourself for any and all emergencies that you can
During
think
the
of that will
procedure.
happen during your procedure.
So true.
Ayun po. Siguro for our last question po, meron pa po tayong question from Sherwin Regonton from Cabsu. How to practice po for proper tension po, Doc?
This one. Maganda to. Doc Raymond, sagutin ko pagkatapos.
Yeah.
Ikaw naman. Okay. O, diba? Naging interactive na, masaya. Okay, sige. So, for proper tension, maganda kasi siguro mag-practice muna kayo sa hindi pasyente. So, pwede kayong kumuha, let's say, ang skin ng baboy. Ano yan? Almost exact. Or may nabibili na rin ngayon ng mga practice na materials for suturing. And then, make sure na every time you do your sutures, dapat sakto sila. Most of the time kasi ang nangyayari is instead na flat siyang ganun, instead na flat na ganyan, medyo nakaangat ng konti yung isang part na dapat nakatapat niya or nasa baba. So pag nangyari yan, ang healing is not good. It will take a long time. And then in case you do your subcuticular na suture patterns, make sure and subcuticular and your muscular na knots, make sure na nakatago sila sa baba ng skin. Kasi minsan din, nakalabas siya sa skin, hindi siya nag-heal. Sobrang tagal niya bago mag-heal until na ma-absorb na yung suture material. Oh, and another thing, nylon, please don't use that, especially for abdominal na mga tahe. Okay? Ano na, gone were the days that we use that. And the silk, pwede na kayong mag-level up na tayo, Pilipino naman tayo, di ba? So, let's make sure that we protect our profession. How about you, Dr. Raymond? May suggestion ka ba para sa tanong na yan?
Well,
Yung
those
proper
are
tension.
very good tips. If you're closing your abdomen, make sure you only include the linea alba. Do not include any muscle, because as you bear down on it, you're going to
Yes.
strangulate the muscle and you're going to create more pain.
Mm.
You do not even need to close the peritoneum. It's just the linea alba. Your holding layer is your linea alba. No matter how good your skin sutures are, if your linea alba breaks, everything's gone. So, nandun
Yeah.
lahat. Yung skin incision mo, kahit maluag yun or so on, that's fine. It will heal, but just make sure that nothing comes out when you do your linea alba. And then with regards to the tension, especially on the skin also, remind yourself that when you're closing, you just need to oppose, not strangulate. Huwag kayo manggigigil na pipigilin ng gusto. Just enough that it touches each other. And bear in mind, when, as mentioned earlier, when it's healing, there's going to be inflammation. So you need to have a little bit of give in your sutures. It takes some practice and observation on how much tension you want to, but need to have something, because lalaki pa yan na ganun eh. That's why you'll notice in some incisions, magka-cut across yung suture mo because you made it on too tight. Nung may inflammation siya, gumupit na. Doon lumalabas yung tawag nila na higad na tahi. Yung marami kayong maliliit na scars. So just enough tension to oppose. There's a way that we can do it. It takes a bit of description, but may paraan yun. I'll just, it's not my place to discuss that here. So,
Pwedeng i-invite si Doc Raymond sa next na topic. Di ba, Doc Raymond?
dito ng gabi.
So yun, maganda suggestions yan. And yes, sobrang tama ng mga suggestions si Doc Raymond. May tanong din dito, Doc Raymond, isa pa. Any preparatory skill before taking surgery on higher years as a second-year student? Oh, ano pala, if I'm not mistaken, Doc Raymond, nag-teach ba kayo ng surgery class before sa UP? Kasi nung nabutan ko kayo, equal practice na kayo. No?
Yeah. So after graduation, I taught surgery for around 2 years.
Ayun! Ayan.
Yeah.
Oh, Doc, I think mas maganda ikaw magsagot nito.
Well, your question, Tristan, is, let's see, what is it?
Doc, ito. No. Naka-PM kasi siya.
Okay.
DM. So, any prep skill before taking surgery on higher years? Ano siya? Incoming student.
Learn how to use your instruments properly. Learn how to hold an instrument properly. The one thing I hate, people holding instruments like this. I don't know if you can see it. That is very, very good. There is a proper way to hold them that gives you stability, that allows you to control it. Instrument use. Read on it, learn on it, and then even if you're not doing actual surgery, a lot of it becomes actually muscle memory, especially the knot tying and so on. Sometimes you'll even do it in your sleep. But make sure you develop the right habits in terms of how to use them and how to care for them. I would say, make sure you're a clean surgeon. Your area is always clean. It is always the habit of new students, after getting an instrument and using it, they will place it on the table along with everything else. Not a good thing. One, you will don't know the organization anymore. You may lose an instrument. We are very lucky that we don't have patients wherein we leave the instruments behind inside. Because who knows, you can't leave anything like this inside the Chihuahua. Maybe a big dog, but you want to keep track of where all your instruments are, where your sutures are. If you have the space, you have your sterile instruments. After you use it, you have a place to put the soil instruments. That way you keep them separate. You may also want to have several packs, especially if you're doing abdominal surgeries. After using one set,
already,
when you're after you've lavaged and everything, when you're closing, you change gloves, use a different set, because you will consider your first set already contaminated. You already opened the abdominal tract. I mean, things like that. always be try to be analytical. Okay, and love what you're doing. The nice thing about surgery is the difference sometimes between that and medicine is with surgery you can almost see your results immediately.
Yeah.
With medicine, a day or two to see if the medication works. It's always very satisfying. And
Mhm.
never forget pain control, pain
Yeah.
medication, preemptive pain medication, intraoperative, and postoperative. That makes a very big difference in the quality of life and recovery.
Agree
It's
sa
like,
lahat. Ay, additional para sa na-mention ni Doc Raymond, it's better, parang mas maganda masinop every time nagsa-surgery. All the instruments na hindi mo nagagamitin, set it aside. Kasi baka akala mo na naka-ano pa siya, meron kang ginamitan. Yung pala, ano lang siya, dirty area. Okay? Remove that, it will cause confusion. And reminder, it's your ring finger, okay? Not your dirty finger that you use. Yung pinakita ng Doc Raymond. Okay? I think
good luck.
open pa. Thanks, Doc. Okay. Okay na ba?
Ayun guys, do you have any questions pa? Huwag na natin itong palagpasin. Ang daming mga docs dito. Lalo na sa ating mga students dyan. Ang daming mga
Pagtutulungan
docs
namin.
dito.
I think Doc Patty
Yes
has
po,
questions.
Doc Patty.
Doc, di ba nabanggit mo nga kanina na yung nylon parang pasay na. Ano ma-recommend mo na magandang suture material? Staples ba? Or for skin?
Okay, Dr. Raymond, I'll go ahead.
Yeah, go ahead.
I normally use PDX, suture materials. Okay, it's a monofilament and it's easy to buy. Staples, we use it as skin. If you want yung staples for yung internal, medyo, hindi ko alam kung saan bibilihin yun. Okay, but then yeah, ang nylon, ano na siya, the only time that I use nylon is kunwari ayoko mag-open agad, perineal hernia. Yung hindi nakakapa ng owner kasi minsan to nakapa, Doc, pero tagal na ng surgery, paano to nahawakan ko? Dito pa. Diba? Plus it will never absorb, it will always be there. Okay? Okay, Doc Raymond. O diba sa'yo?
Doc Ivy, may question po si Rena Fe Punzalan.
Okay, time out. Kunin lang natin yung ano ni Doc Raymond, imagine. Hindi siya natulog ngayon.
Yeah, so there are a lot of synthetics that you can use, and the general rule is you can actually use your absorbables for the skin, but as much as possible, try not to use your non-absorbables inside. I still use nylon occasionally for skin, lalo na pag let's say it's something that really needs to be there for quite a while because, as you know, it's monofilament, non-absorbable, and how to say this? The problem with nylon is it's not security, and the fact that if you cut it too short, sometimes that little end is irritating. Not too many people use nylon, as Doc Ivy said. It's not that readily available, but it's still available if you can. But I would say move up, as he said. If you find the suture material expensive, charge it to the owner.
Yep.
Well, don't consider it as, oh, sayang. No, use it because it's the best that can be. What you're doing is you're doing it for the benefit of the patient. And then charge appropriately. Pag tinanong, bakit mas mahal? Kasi I'm using this, I'm using that, we're doing this, we're doing that. You can always justify it.
So, Doc, yung staples ba? Ma-recommend mo mga stapler?
I typically also use staplers or staples, skin staples, basically, especially if you're in a hurry, because it's very quick. But try not to rely on the staples themselves alone. You can use it for small wounds and skin only, but let's say for abdominal incisions, you either still need to do a subcutaneous. Then I sometimes do an interrupted on top. My favorite is a cruciate, but I do cruciates far apart with at least an inch in between. And in that area in between, that's where I put a staple. So it saves me time.
Yep. Agree.
Have you encountered problems with reaction of the patient to suture materials?
Okay. Yan, for me, with PDX, not so much. I have seen that sa mga yung gumagamit ng silk. But PDX and surgical or Vicryl, not too much. Very minimal with staples.
I think there was
Okay.
somebody who wanted to ask a question.
Yeah. Ito, si Reina Fe
Punsalan.
Punzalan.
Ay, hello po, Doc Ivy. Doc, hindi ko na nasubaybayan yung lecture kasi
Ay,
may patient.
sayang.
Pero I hope pag relevant Doc yung question ko, ipasagot na lang, Doc. About sa
Okay.
SPAY kasi, okay lang po ba na mag-convene niya ako na for 2 weeks? Para bang ang point ko dito, Doc, hindi na ako, para hindi na ako mag-advise ng oral medication na antibiotics saka anti-inflammatory. Would that be possible? Ang plano ko kasi, magde-dexa ako for 3 days. Every 3 days siguro twice yun. Dalawang magkasunod na dexa tapos convene niya na good for 2 weeks daw po yun. Anong opinion niyo yun, Doc, sa
Okay.
plano ko for spay ng dogs. Tapos pag sa castration siguro ng dogs, mas ano ba, parang possible kaya, Dok, na, I mean, or magaling ko in mind. Safe ba yun,
Okay.
Dok, na hindi na ako magpa-oral sa client? Eh, hindi ko rin alam kung anong level ng compliance nila sa pagpapainom. Tapos para mas stress-free, parang nasa all-in na sa akin lahat yung sa medications.
Okay, let me answer that one at a time. Convenient? Yeah, you can definitely use that as an
Wala ata.
antibiotic. Hello, Reina Fe? Yeah. Convenient? Yeah, very convenient
yes.
yan na gamitin as
Opo.
antibiotic na of choice. Pero for us dito, Doc Raymond, we still use antibiotics for safety. But then other countries like the US, may mga practitioners dyan that if you feel comfortable that it's clean, you really don't need to give antibiotics anymore. We don't really give dexamethasone since it's steroid, and steroid prolongs healing. So what we do is we give pain reliever. So NSAIDs,
ganun ba, Doc?
non-steroidal anti-inflammatory that are also flavored. So you don't
Nawawala.
really, so pwede ka mamili ng mga non-steroidal anti-inflammatory na available like Firecoxib, which is available here in the Philippines and it's flavored, pwede mo gamitin yan. And it's easy to give.
Okay, Doc.
Clients is fast.
How about, Doc, yung tolfenamic acid? NSAIDs po.
Yeah,
I'm
tolfenamic
sure ako, Doc,
acid. Okay. Sa practice namin, most of the time, if kaya na oral, na hindi masasaktan yung patient, then that's what we give. Yeah, injectables, pagtulog sila kasi di naman nararamdaman. Pero kung gising, then better yung less pain possible. Sa US ba, Doc Raymond? Sa US ba? Ganun din.
Well, for spay neuters, typically in high volume, high quality spay neuters, you only give your pain medication and your antibiotic pre-surgical. After that, you don't need it. For the main reason that the studies have shown that for any procedure that's less than 30 minutes, as long as you do it cleanly, the chances of infection are very, 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 very low. So most don't really send home anything anymore. Okay, you can, for your case, you can choose. Convenia is possible, but be mindful that you don't want to create antibiotic-resistant bacteria. Meaning, judicious use of microbials. If you don't need it, don't use it.
Oo nga po, Doc. I have read na yung medyo baka magkaroon ng resistance kung gumamit ako ng Convenia kasi good for 14 days. Tapos parang hindi ata agad siya matatanggal sa katawan, hindi mare-reverse kung in case na kailangan ko siyang
and if there's something that it won't kill and so on, and you might end up with the resistant. And then I agree with Dr. Zialcita that dexamethasone is not a good post-op pain. It does have anti-inflammatory effects, but it does retard healing. So you really are better off, and the standard really is non-steroidal anti-inflammatories. You have your carprofen, your meloxicam, your florbuprofen. I don't know if you already have robenacoxib there, firocoxib. There are quite a lot of ones. there are quite a lot of choices that you can,
Okay.
and you don't need to give it for very long. Typically here,
Mhm.
3 days post-op.
Mhm.
Okay, Doc. Very helpful po yung about sa DEXA. Kasi yun yung yun yung tinuro sa akin sa ano ngayon. Pero ano na lang, I will adjust na lang to yung NSAIDs na lang po. Thank you so much, Doc. Okay na po ako.
Thank you.
Thank you.
Okay, any more questions? Okay, I think wala nang question. Tan?
Okay, if wala na po tayong questions, before we end this afternoon, we have prepared a little game for you guys.
Yes, may pa-games po tayo. And of course, we also have a prize. Kaya, be ready.
Siyempre, bagong-bago itong game natin. Paboritong games ito sa mga Jollibee party.
Ano ba yan, partner? Trip to Jerusalem ba yan?
Ano ba yun, partner? Paano naman gagawin yun sa online? Siyempre, ang game natin ay,
Ay, sorry.
siyempre, Bring Me.
Wow, bring me. Gusto ko yan. Paano naman yun ngayon online?
Madali lang yan, partner. Kailangan lang mag-unahan ng ating mga participants sa pagdala ng ating items at ipakita sa camera.
Tama. Para rin mas makita natin ang pinakamabilis, gamitin natin ang raise hand button, which you can see sa lower right ng inyong screen. Again, let us use the raise hand button para malaman po natin kung sino ang pinakamabilis.
At kung gumagamit naman ng cellphone, you need to click first the three-dot icon, then lalabas na ang raise hand button.
Yes, alright. Handa na po ba kayo? Tandaan po natin na meron pong prize ang game na ito. But first, let's have a practice round. Ipapakita po sa atin ni Tan kung paano ba gagawin natin. Okay. For example, bring me a pen. Ayan, nag-raise na ng hand si Maria Teresa Quintero. Pwede po bang ipakita sa video ang ating pen? Ayan po. Doc Maria Teresa Quintero. Pakita po natin sa video ang ating pen. Ayun. Ayan. So, ganun lang po kadali, guys. We request everyone to turn on their videos ngayon pa lang po para madali na po natin makita ang item. And, pipindutin nyo lang po ang raise hand button para makita po namin na kayo ang nauna.
Okay, since tapos na tayo sa practice round, okay, eto na, tunay na talaga to. So, ang first item natin ay, bring me a picture of your pet. Okay, paunahan po tayo sa pag-raise ng hands.
Ayun, meron na agad si Doc Ana.
Okay, Doc Ana, patingin po kami ng picture ng pets nyo.
Nasa cellphone, pwede ba?
Okay lang po, Doc.
Sige po, Doc.
Teka, i-exit ko yung Zoom. Kita ba? Kita ba ako?
Apo.
O na lang. Yes. Wala. Yes, sige. 3, 2, 1. Hindi na. Nawala. Nag-close eh. Sinong next? Sorry.
Ayun po.
Pampagulo.
Sino po ang next natin? Okay. 1. Okay. Ito po si Doc Patty. Nasa unahan natin si Doc Patty. Ayun! Ang cute naman po ng dog. Ano po bang pangalan niyan? Ang cute naman po ng dog ni Doc Patty. Okay. Meron na tayong 1 point for Doc Patty.
Sabi siya, go.
Ang next naman po nating item ay PRC ID. Ayan, sa mga docs natin. Patingin naman po ng inyong PRC ID. Ayan, meron na agad si Doc Maria Teresa Quintero. Ayun, nagpakita na agad si Doc Patty. Ayun, ayan din si Doc Maria Teresa Quintero. Okay, now we have 1 point for Doc Quintero and for Doc Patty. Okay, next item na tayo, partner.
Next item naman natin, since para naman sa mga students or pwede rin mga vets natin dyan if nasa inyo pa rin po. Bring me your student ID naman. Ayan, paunahan po tayo.
Saan na po ang student? Ayun, si Francesca Calderon. Ay, nawala. Si Darlene Cueto.
Ayan.
Ayun, pinakita na ni Darlene Cueto. Wow. Okay.
Ayan, so far may 1 point na si Doc Patty, si Doc Maria, and si Darlene.
Ayan.
So paramihan po tayo ng points dito.
To the next item. Ang next item natin ay stethoscope. Ayan, para sa ating mga docs and para sa mga students na nakabili na. Doc. Okay. Ang stethoscope, guys. Asa na po ang ating stethoscope? Ano po bang brand niyan? Littmann? Baxtel? Wala po bang may dalang stethoscope? All right. I think walang merong stethoscope on hand ngayon. Sayang naman. Sayang ang 1 point. Okay.
Ayan, sige, mag-proceed na lang tayo sa next item natin.
Doc Mia?
Si Doc Mia.
Meron na po. Ayan. Pwedeng i-on nyo na lang po yung mga videos nyo para pakita. Ayun, nauna si Francesca Gia. Pinakita niya ang stethoscope. Wow, ready. Okay.
Ayan, sige. May 1 point na si Doc Patty, si Doc Maria, si Darlene, and si Cheska.
Okay.
So next item na tayo. Bring me
Ayan, bring me thermometer. Paki-open na lang po ang ating video para makita ang thermometer. Ayun, si Doc Patty.
Ayun, si Doc Patty ang nauna.
2 points na si Doc Patty. Wow. Mukhang meron ng prize ngayon si Doc Patty, ha? Sayang naman yung stethoscope ni Doc Patty. Next item na po tayo, partner.
Ayan, ang ating next item naman ay bring me, while wearing white lab gown.
Ayan, patingin naman po na itsura ng ating mga doctors. White lab gown.
Ayan, si Dr. Jan.
Ayan, sige. Dr. Jan, sige po. Asan na? Paki-raisehan na lang po. Para po Ayun.
Ayun, nauna na po si Dr. Jan.
Opo, Doc Patty, kailangan po naka-wear tayo ng white lab gown. Kaya meron na pong 1 point si Dr. Jan.
Ayan, ulitin ko lang po ulit muna, si
po.
Doc Patty ay may 2 points na, si Doc Maria may 1 point, si Darlene may 1 point, si Cheska may 1 point, and si Dr. Jan may 1 point. Ayan.
Ayun. Ang next item naman natin ay syringe. Ayan guys, syringe. Meron po bang mga nakatagong syringe dyan? Sige po, Doc Jan, Doc Maria. Ayun,
Ayan,
nauna
si
na naman si Doc Jan.
Yan, 2 points na si Doc Jan. Nauna po si Doc Jan, Doc Patty. Tay na po
Wow.
kayo, Doc Patty ni Doc Jan.
Yes. Nako, baka mahati pa po ang ating prizes. Pabilisan po tayo. And next na po nating item ay dog collar. Dog collar po.
Okay
Pwede
lang
rin
po
pong-
kahit nakasuot na sa dog nyo. Dalhin nyo na lang
Yes,
po yung dog nyo.
Patingin naman po ng mga dog collar. Pwede rin po sa cat. Basta collar po ng inyong pet. Si Doc Jan tsaka si Doc Patty. Ayan, si Maria
Ayan, si
Francesca.
Cheska. Ayan, nauna si
Wow!
Cheska.
Cheska. Meron na ding 2 points si Cheska. Partner, patingin nga ng points.
Ayan, so si Doc Patty may 2 points na. Si Doc Maria may 1 point. Si Darlene may 1 point. Si Cheska may 2 points. And si Doc Jan may 2 points. Ayan, tayo silang tatlo. Si Doc Patty, si Doc Jan at si Cheska.
Wow, okay. Bilisan na po natin para makahabol pa po tayo. Ang next naman po natin ay nameplate. Yung ginagamit po natin as a veterinary student na mga nameplate. Nandiyan pa po ba ang inyong mga nameplates? Patingin naman po kami.
Ayan,
Si
nauna
Doc
naman si Doc
Patty.
Patty.
Ang bilis ng kamay ni Doc Patty. Mukhang meron na
Ayan,
tayong
leading na si Doc Patty. May 3
Leading na
points
si-
na siya. Then
Okay.
next, si Doc Jan may 2 points. Si Cheska may 2 points. Then si Doc Maria and Darlene may 1 point.
Ayan. Meron na tayong last item. Last item na ito, guys. Baka pwede pa kayong humabol. Ang next natin ay EdtaTube. Yes, EdtaTube. Yung kulay violet po ang cover. Ayun,
Ayun, si Doc Patty.
Nilaman pa. Doc Patty, ang galing naman ni Doc Patty. May laman pa ang EdtaTube. Okay, Tristan, sino ang nanalo?
So ayun, ang ating winner sa palarong Bring Me ay si Doc Patty. So ayan, Doc Patty, antayin nyo na lang po ang aming message para po sa inyong premyo. Salamat po sa pag-participate po sa ating Bring Me game.
Tama. I-email na lang po natin ang ating organization para makuha po natin ang prize. Ang prize ay isa pong surprise din. Ayan, ngayon gusto po naming magpasalamat kay Doc Ivy Alvarez Zialcita and pati na rin po kay Doc Raymond para po sa isang napakagandang at interactive na talk.
Let's
Ayan
give
po.
virtual applause po.
Ayan, let's give our virtual applause na lang din po. Wow, yan. Thank you po, Doc Ivy, Doc Raymond. And also, we would like to thank Samahan ng mga Dalubhasa sa Palagumutang Hayop sa Palawan for bringing us this series called Dalubhayop Tech Talk. With that, please like our Facebook page to be updated on the upcoming seminars.
Ayun po. So regarding the certificates of participation naman po, please answer the post-program survey that the link was sent in the Zoom chat box by Doc Ian. And yes, you can also join us on June 15, where the husband of Doc Ivy, Doc Luis Guillermo Zialcita, will give us a webinar about anesthesia.
Yes, abangan po natin yung webinar ni Doc Luis Guillermo Zialcita about anesthesia. And now we would also like to acknowledge our partners, UP Rodeo Club and UP Tarabidan E, ang mga Palawenyo, who made this webinar possible. Again, please answer the post-meeting evaluation to receive your certificates. Ayan.
Picture muna,
Thank you.
picture.
Okay, sige po. Everyone, please turn on your cameras for a photo of
Pakiturn on na lang po ang camera natin para po kasama po tayo sa picture.
Wow! Okay, I think everyone is open na ba? Ayan, sige po. I'll count to 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Ayan, magka-take na po tayo ng picture. 1, 2, and 3. Okay, isa pa pong, wait lang po. Okay, another photo. 1, 2, and 3. Ayan po. Okay, thank you everyone for attending this session. Abangan nyo din po sa aming Facebook page ang mga susunod na series ng Dalubhayop Tech Talk. Again, thank you everyone for coming and thank you Doc Ivy, Doc Raymond, and Doc Ian for bringing us this webinar.
Thank you.
Thank you everyone.
Thank you.